Okay. Good afternoon, folks. Welcome to the Joint Conference Committee for the Laguna Honda Hospital and Rehab Center for November 12th, 2024. Mr. Morwitz, can you call the roll?
Yes, I'll start with you. Commissioner Guillermo.
Present.
Commissioner Green.
Present.
And Commissioner Chow.
Present.
Thank you. I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. We can move on to item 2, which is the approval of the October 8th, 2024 meeting minutes.
Okay, you have the minutes in front of you, and if I can ask if there's any, if there's a motion to approve.
Move to approve.
Second.
Okay, any public comment?
Is there any public comment in the room on the minutes? I see none, and there's one person who's obtained remote public comment permission. Is that person? That person does not have a hand, so all those in favor?
Aye.
All right, thank you. We can move on to item 3, general public comment.
Okay, we have a member of the public, Mr. McAfee.
And for everyone making public comment, I've got a timer. When the timer goes off, please know that is your time to end your statement.
Earlier today, me and Mr. Morowitz had a chance encounter, which I asked him a question, and he gave me an answer, and I rudely walked away. He got my attention and explained to me that he was a human being, and that I had disrespected him by not expressing the gratitude he deserved after having given me the information. He was correct on all those accounts, and I also want to thank him for calling me on it. It's important, truly. Thank you. It's important that all members of the public respect public employees. Conversely, public employees should respect the public. Ryan Alexander is a resident at Laguna Honda. He was informed that he had been conserved after it happened to him. He was never informed that the process was happening so that he could defend himself against it. My domestic partner, Randy Waltz, went to UCSF Medical Center, where they cut off my right to visit him. He's my domestic partner, because I asked what his diagnosis and prognosis was. We were put under a no contact until discharge order. He was rendered unconscious and taken to Laguna Honda Hospital without his knowledge or consent. Had a bracelet put on him. He's not been allowed to leave ever since. His payee withheld share of cost money that was supposed to have been going to Laguna Honda. It was padding Randy's account. The hospital phonied up an advance directive note, which took away our rights and gave them to his dad, who got $8,000 or $9,000. $6,000 he gave to Randy's mom, his ex-wife. $2,000 was supposed to have gone to Laguna Honda. After Randy got $75,000, it was all gone. Plus his dad bought an end-of-life policy on Randy. Is this the way we show respect for the public? Don't tell them that they're being conserved? Kidnap them? They even lied about my partner's condition. He was cognitively impaired to the point where he couldn't do a power of attorney. From Laguna Honda, he called the lawyer to the power of attorney. That's how we got the transaction register from his payee. It showed they had been embezzling his money. All sorts of people know about this. What you discover is that Laguna Honda employees are to be preserved and protected. They can say it, and I can prove it. It goes all the way to the DOJ, all the way to the Department of Justice, the Attorney General's office, and the FBI. They have evidence of Laguna Honda's criminal activity and are just hiding, keeping it kept away.
Your time is up, Mr. McKay. You're welcome to.
Hold on, let's get this clear about. Hold on.
No, your time is up. But you're welcome.
You misquoted me again here.
You're welcome to submit a written statement.
That'll do.
Okay. That is the only public comment for this item.
Okay.
We can move on to item 3, which is the executive team report.
Good afternoon, Dilter.
I will pull up the report. Give me 1 second. Another presentation. Okay.
Good evening, Commissioners. My name is Deltar Sidhu. I'm the interim CEO and nursing home administrator for Laguna Honda Hospital. And I look forward to providing you with our monthly update today. So before we begin, I wanted to share that last week we hosted, Laguna Honda hosted surveyors for our annual recertification survey. Surveyors exited Friday, and based on their preliminary findings, during the exit conference, it was a very successful survey. While we always expect some findings, our goal is to ensure the findings are as few and they're low in scope and severity. Teams are now hard at work developing their plans of correction based on the preliminary findings as we await the official 2567. During the exit conference and throughout the survey, surveyors were very complimentary of Laguna Honda staff and the improvements made by the facility. So I want to share my gratitude with Laguna Honda staff and their hard work in making this survey successful. Thank you. Next slide. So the new admissions to Laguna Honda are continuing to go very well. Since resuming admissions on July 31st, we have welcomed 7 of our former Laguna Honda residents. As of today, 24 new admissions with a total of 31 admissions. There are currently 10 applications in progress. Many of these have tentative admission dates planned. There are currently no wait list for Laguna Honda, and we are admitting the application for all priority groups. We're working with providers to increase the number of referrals, which we all know will take some time since we were closed for almost 2 years for new admissions. Teams are conducting outreach and education on the Laguna Honda admissions process. This has included hosting information sessions with the area care coordinators and community groups to share more about our referral process. We're also offering tours to prospective residents and providers so that they can see the beautiful campus Laguna Honda has. Slide. This slide, as you can see, this shows the in-depth view of our admissions data broken down by each priority group. As you can see, the majority of the admissions are coming from San Francisco Health Network, especially Zuckerberg Hospital. Are there any questions on graph?
Why don't you continue your report first, and then we'll ask questions.
Next slide. Laguna Honda remains committed to admitting residents who meet our admissions criteria. This is critical to ensure that we continue to provide the best care to every resident, and also so that we remain in regulatory compliance. This slide shows a breakdown of why the applications that's been denied. As you can see, we have denied a total of 19 applications since resuming admissions. 6 were denied due to no skilled nursing level of care that was identified. 9 due to complexity of their behavioral health needs, and 4 were denied based on the complexity of their medical needs. We do anticipate that the rate of denial of these applications will decline as we continue to work closely with our providers and clearly communicate our admission criteria. Okay. On the respiratory illness, as you know, we are in the the season for respiratory illness officially began on November 1st. We all know skilled nursing facility residents are particularly vulnerable, and each season we do our best to limit the spread, keeping our community healthy. So effective November 1st, Laguna Honda increased staff masking and re-implemented the daily employee symptom screen. These measures are in alignment with the local and state regulations and will be in effect through at least April 30th of 2025. Masking is now required in the hospital building and select areas in the administration that host resident programming. As of today, there are no units on outbreak status, and we have no active resident cases, with only 3 staff cases. We remain responsive to the situation and will adjust precautions as needed and per the regulations. As we all know, vaccines are an important way we protect ourselves and each other during respiratory illness season. On the staff side, last month Laguna Honda hosted 4 on-site vaccine clinics. During those 4 clinics, we vaccinated about 655 staff for flu and 274 with COVID vaccine. We're in the process of updating employee records with vaccine received outside of Laguna Honda. As we know, many of the staff receive their vaccines from their local pharmacies or their primary care providers. For the residents, the fall vaccine campaign for flu and COVID is well underway. Currently, we have vaccinated about 65% residents for COVID, which is a total of 274. We vaccinated 337 residents, about 80% for flu. And any residents who are 65 and over are also being offered the RSV vaccine. So at this time, we have vaccinated 210 residents, about 63% of those. Pharmacy, nursing, and infection prevention and control continue to encourage vaccine uptake by educating residents and their family members. Next slide. As you know, part of our sustainability planning, Laguna Honda is partnering with CMS regulatory experts for a series of full organizational assessments, which includes mock surveys. These assessments support compliance with CMS regulations and help sustain the critical improvements we made during the CMS recertification journey. Last month, we completed our first mock survey, and now we await the official survey findings. This was a full survey with the health inspection portion ending on October 25th, and then the fire life safety and emergency operations portion ending on October 30th. Findings during the mock survey were addressed immediately, mirroring a real survey. We also wait for the full organizational assessment and will develop plans of correction based on their recommendations. Mock surveyors shared that Laguna Honda staff were very welcoming and fully engaged with the survey process. They were also very complimentary. Not only the welcoming part, but also the confidence that the staff really showed during the surveys. The mock survey ended right before the annual certification survey, and it helped ensure that Laguna Honda was extra prepared and ready for CDPS surveyors. Once again, I want to recognize the staff for their hard work and engagement with back-to-back mock and real survey. As part of the recertification process, Laguna Honda was required to convert all triple rooms to doubles to align with the new CMS requirement, which resulted in a loss of 120 beds being taken offline. We're committed to again recertifying those 120 beds via a waiver process. We continue to make clear the need to recertify the 120 beds to CDPH and CMS. In turn, CDPH and CMS have made clear that they're prepared to receive and consider a waiver application once Laguna Honda has demonstrated a sustained period of regulatory compliance. At this time, Laguna Honda is still in that period of demonstrating regulatory compliance. We will submit the waiver application at the earliest opportunity to ensure success and will continue to be in touch with both CDPH and CMS. We are optimistic that a successful annual certification survey will help move this process forward. And finally, this is our long-standing slide, shows state of the hospital. In October 2024, we had 10 new admissions, 7 planned discharges with no unplanned discharges, and 3 expirations. The average daily census was 416 in October and increased from September by 6 residents, which was 410 in September. Okay, this concludes the report, and if there's any questions, thank you.
Thank you, Deltar. Excuse me. We have a member of the public that wants to speak to this item. Mr. Deckelman?
I believe it's item 4.
This is item 4?
Yeah.
So, yes, this is your item. And Mr. Degelman, I've got a timer. When your timer goes, I've got 3 minutes. When the timer goes off, know your time is up.
Okay, thank you. Good afternoon, Commissioners. My name is Norm Degelman, and I'm a member of the Gray Panthers. And I'm here to talk about Laguna Honda. While we are grateful that Laguna Honda admissions are now ongoing, San Franciscans deserve more transparency and a monthly breakdown of who is being admitted and how long San Franciscans in need who are eligible for care at LHH have to wait. We realize this is still a work in progress, and thank you for your time.
Thank you for your comments. Is there anybody online?
Yes, there's one person who's received permission, and that person is there. Dr. Palmer, I've unmuted you. You've got 3 minutes.
Okay, hi, can you hear me?
Yes.
Okay, yeah, I had the experience in 2017 of being completely overwhelmed taking care of my mom, 99-year-old demented mom at home, and I knew she was nursing home eligible. And at that point, my own health was failing due to the stresses of caring for her. And it required extensive paperwork and interviews to get Laguna Honda to say that she was eligible. And then I was told there would be an indefinite wait for admission. And this was really unacceptable. There was no way we could gauge if she had a shot at all. And had my health completely failed, I would have been in the position of having to bring her to an emergency room and refused to take her home. Many families in San Francisco are now or will find themselves in this situation. The elderly, taking care of the elderly is especially problematic. And we need to know we need transparency about a waiting list, and we need more transparency with your graph at the monthly JCC. Is in process now really a waiting list? How long does in process take? And what does the closed category mean on the admissions update? If people that are closed because they're temporarily not stable enough for Laguna Honda, if they stabilize, do they have to go through the whole process again? And please, we need a monthly breakdown. A cumulative breakdown does not supply transparency about how long people are waiting or what is going on currently. And it obscures the current reality. And so I would encourage the Health Commission to advocate for a monthly breakdown of all categories and with transparency about the wait for San Franciscans to get into Laguna Honda in all categories. I also would encourage you to tell me exactly what you're doing. Tell all of us, exactly what you're doing about those 120 beds. Thanks a lot.
That's the end of the public comment for this item.
Okay, thank you. Are there any questions or comments from members? Okay, Dr. Green.
Well, yes, thank you for the report and the graphs. I had 3 questions. One is, it looks like, you said at the beginning that there were 31 admissions, but the total under admitted on the graph is 28. Do you know why was that difference between the 31 and the 28?
Let me look at it. Let me call on Zoe. She might have more information. Zoe Bursell.
Well, that's fine. And you can just let us know.
We can clarify that and
Okay.
get back to you.
I'm here.
Oh.
Sorry. So at the time that we made the slides, it was 28. It is now, we've admitted since then, between I believe last Thursday and today. So the number that Diltar read out at 31 is correct.
Oh, thank you. And I guess the second comment I was going to make actually is somewhat in reference to the public comment that was just made, is I think it would be very helpful for us to have more granularity about the admissions process. For example, it may be that, I hope you have target days at least. I realize that many of these individuals, you can't admit them until you get information from sources over which you have no control. But as we admit more residents, it might be really helpful to get a feel for what the range might be. In other words, if someone's being admitted from the general, is it going to be, a 5-day turnaround? In other words, if someone's coming, from the community, if we could give the public and us, I think, a sense of expectation in terms of, each one of these groups is quite diverse, and it may take a lot of loose ends put together to have someone who's coming from home, for example. But it would be helpful to get a feel as you get more data about, how to set expectations. And, in line with that, I think, I think we're glad to see that there are individuals that you're recognizing for behavioral health needs can't come to Laguna. But it would also be helpful to have a little more granularity about those that we can't meet the medical needs for. I mean, are there people that need, a more a rigorous, acute care facility? It would just be helpful to get a sense for that. And obviously, I don't expect you to answer that. And then the question I have is we've talked about the 120 beds and how important it is to have evidence of regulatory compliance. And now that we've had a survey, do we have any sense for what that looks like? In other words, if with this survey we've got great compliments, but we get a 2567, how do we interpret that? In other words, do we have any thoughts about at what point the enemy of better is best, and we just have to go for it in terms of reaching out on the beds? I wonder if you have any ideas on any of that.
I mean, survey is definitely, and thank you for your question, Commissioner. Survey is definitely a way of showing sustained compliance, right? We are meeting with our partners quarterly with CMS and CDPH. So this will definitely be a conversation with them. So as the developments happen, we'll definitely share those updates here.
Thank you.
Any others? Dr. Chow.
Thank you. And I'm wondering then, as your response in terms of the admission update is going to be on a monthly basis, whether we will then convert this from what appears to be quarterly to a monthly, where we'll be able to then track how many are actually coming in on the different priorities, because then we would have a trend. as to where we were going. I note that you did answer also a question I also had, but it was there that you have 24 residents who are still no longer requiring skilled nursing level of care. Do you have an idea as to were any of the discharges that we are seeing on your graph related to that? And perhaps we should understand how we are doing with those who no longer need skilled nursing care, as a report that shows, that now we have 24, because we know the number fluctuates, but we are moving them, and that the other discharges were in fact a fulfillment of SNF requirements and where the discharge went. Because I think people are concerned that we are able to, whether we're able to discharge in our immediate community. That's just kind of a refinement of where we're going, which is great. But as we're looking for the future, it'd be really good to know we've fulfilled our skilled nursing or acute rehab, and where then these people have gone. On the acute rehab, I'm not. It's actually not distinguished here. So I'm not sure what happens if, or are you combining that the skilled nursing admissions include those who really go on to acute rehab and those who don't?
No, we will have that data separately. So these are SNF admissions only.
Sure.
Yes.
And I do think that, as we've talked about for a number of years, in the future we'd like to understand how we are actually going to continue to improve our acute rehab census and reach out. And we know there are challenges there, but if we don't start concentrating on that, that's another area where we can actually be of assistance in the community, right, for the acute rehab. Now, and I think along that line, I think one of the questions, not just for Laguna, but for the overall health network, is how many of our acute rehab from San Francisco Health Network come to Laguna? Are they all coming to Laguna, or are they going elsewhere?
Thank you for your question. We'll definitely provide you that information once we have it.
Okay, because now that we are now moving forward, this is just looking at the vision as we go along. I also hope that as we are able to understand better the CMS approach, it would be nicer to then, as Commissioner Green noted, for us to understand, are we now talking about being in a sustained period, which means a quarter or 5 years? And the latter answer would require some, a review really of what sort of answer we're getting from the government, right, in regards to this. So I think if at some point you're able to make a better refinement, especially since we understand you're in discussions with them, it'd be really great to understand, what they're looking for. They're looking for 2 periods of improvement? Are they looking at our mock surveys and finding those are useful? Or are they talking about 2 annual surveys? And that would assist us to understand our anticipation in terms of trying to get back to the max number of beds that we would have.
Thank you, Commissioner, for your question. Definitely those are the conversations we will have, and we'll provide an update in the next meeting.
Very good.
As we have more information. And just quickly on the discharges, we do track these residents who were identified as no longer needing skilled facility services versus all the new admissions that we're getting. And those are short-term admissions, and we're discharging. We are tracking that data separately, and we're more than happy to share that. But as a brief update, from the new admissions that we have taken, we have discharged at least 3 of those residents back to the community. So the teams continue to make every effort, making sure that we are not going back to our past ways, right? Every resident who comes in, we're making sure we're working with them to, we're aligned with their goals and integrating them back to the community if that's what their goals are and that's what, we're able to do. And as far as the other residents, as we have shared in the past, there are challenges. There are different type of challenges. Some residents need to be conserved. We're working through that process. Some are non-compliant with the discharge process, so we're engaged with CDSS and DHS, working through those challenges, and we continue to make progress. And yes, some of those discharges are part of that. We are going through appeals process, letting these residents go through their appeal rights, so we can assist them moving along in the process and discharge them back to the community.
Very good. Thank you very much.
Thank you.
I just had a couple questions first. I wanted to share my agreement with both Dr. Green and Dr. Child's comments regarding the 120 beds. And I know that even though you're meeting regularly with CDPH and others that have a say on what is considered sustainable progress, I think it would be helpful if we could get a little flavor of what that discussion is, and more than just, we're continuing to talk, because that otherwise leaves it, it's quite vague otherwise. And so I know that there are more specifics that happen in the meetings, and so those can be shared a little bit more when you're able to have more time on the agenda and more substance to provide a reasoning for the waiver and how that is going. So that would be appreciated. The other question I had is on the admits. In terms of, even though it's only been like 3 short months in terms of opening back the admissions process, and so not being able to have sort of an average time frame of what, the process, how long the process takes, and because probably every admit is quite different from the other, at least having a sense of what was the shortest and what was the longest for now, because it's hard to have averages because it's relatively few admits over the 3 months. And so maybe over 6 months to 9 months, you'll have a better sense of what are the sort of categories that you can put folks in besides the priority listings, and what are some of the timeframes associated with those categories. In the meantime, if you can just sort of maybe generally give us a sense of this, the shortest time was, 2 weeks, and the longest time was, a full 3 months.
Thank you for your question,
Yeah.
Commissioner. Definitely, we can share some of that information. It's just at this moment, given the volume of the admissions, and each category is quite different, right? Obviously, priority 1, these residents came from another SNF. So versus taking admissions from hospitals, so the review process is different. However, as we move towards getting more and more admissions from community hospitals, we will be able to project better how soon we are, approving these admissions. Currently, looking at the data, lot of the referrals we are receiving are the patients who've been in the hospital for quite some time, and these are challenging patients and requires a lot more a thorough review of these admissions. And as we are noticing the trends with the application we're receiving, we're sharing that feedback with our partners, whether it's Zuckerberg, other community hospitals, so that we can improve, one, receiving the referrals that they're complete referrals, so we're not receiving incomplete referrals, and also that we are approving them at a much faster rate. So that work continues. The teams are working on the PDSA to make sure that we are approving them at a much faster pace.
That's great. Even that information was really helpful. So thank you for that. And then I had another point. One, again, really good news on the survey. Glad to know that it appears as though things have gone relatively well. They went home, I think, a day early. So that's sort of hopefully that's a good indication, or at least they didn't extend their survey days.
Thank you. They were expected to leave on Friday. They did leave on Friday.
Okay.
right? There was no red flag during the survey. As we said, this was a successful survey, so that's a good indication. But nevertheless, we will continue to make efforts to even further improve, right? That's always the goal, that we are continuously making the facility better.
Was there anything from the mock survey that was reflected or reinforced in the actual annual survey that is either sort of good news or of concern in terms of what the plans of correction, what you might anticipate plans of correction might be, and not just for the mock survey, but also for the annual survey areas, whether it be fire life safety or some of the other things that you could share with us at this time?
So thank you for that. So fire life safety, we obviously haven't had a CDPH survey. We're expecting them any day, right? So the teams are ready. So there isn't any data to share whether we had any findings which overlap. But from mock survey, I don't have the findings in front of me, but I believe there weren't any overlap. Some of the things identified during the mock survey weren't identified, as we do correct these deficiencies immediately as they are identified, and they were not discovered during the survey. Obviously, they have been corrected. And even during mock survey, as we said, mock survey was very successful. Will they find some deficiencies? Of course, we always expect them to find something, right? But none of the findings were surprise to us, as we know that we still have some work to do, and we continue to work towards, a continuous improvement. But there was not really an overlap between the findings.
Okay, great, thank you. Any others? Okay.
Yes, so if you could, before we mention the annual report, if I could give 2 cents on the waiver discussion, if I could piggyback on you all commissioners, because we have a new administration coming in, it might be something to mention to the CDPH and CMS that we don't know how that administration is going to interact with anything, and it might be like a tiny nudge and a tiny pressure to just note that if we could, quicken the process on our end, of course, that benefits us, but that might be something to mention in case it hasn't been mentioned.
Thank you.
Sure. And then would you like to say anything about the annual report?
Yes, I know the report came out late, but we look forward to your comments and your questions via email, and then we'll respond accordingly. Thank you.
Thank you. I did a really quick sort of flip the pages, and at least aesthetically, it looks very good, and it looked like there was quite a bit of content to be able to share and review. So look forward to being able to make some comments on that report.
Thank you.
What is the deadline for the comment?
I will email you, and I'll check with staff and let you know. There's plenty of time. This will be presented at I think the December 17th. It's the second meeting in December is when the report will be finalized. So there's plenty of time between now and then, but I'll check with staff. I'm assuming the next 2 weeks would be fine.
Okay, that would be good. Okay, we can continue.
Okay, great. Thank you.
Thank you.
We will move on to the hiring and vacancy report.
I hope you can see me.
Yes, we can see and hear you very clearly.
Thanks, Mark. Good afternoon, commissioners. I'm thankful for the opportunity to present the vacancy report for October data in November. So we hired a total of 15 employees across classifications between October 1st and October 31st. We had 3 separations during the same period, no retirements. We continue to prioritize and support the hiring of the registered nurse class. Vacancy rate for the registered nurses classification stands at 3% for the month of November, which translates roughly to 6 vacancies. For these vacancies, we are currently in the process of moving candidates through the selection process. There are currently 11 openings for the licensed vocational nurses or the 2312 classification. Again, even with these vacancies, we're currently in the midst of the selection process. The HR team is also continuing to process vacancies with several classifications through an efficient batch hiring process. We currently are having 4 batches in the active hiring phase. We have 19 vacancies across DPH for the 2587 Health Worker 3 classification, all of which in the selection process. The team is also actively hiring for 17 vacancies in the 2593 classification Health Program Coordinator 2 roles across DPH locations. Batch hirings for 2903, the hospital eligibility worker, where we have 16 vacancies, and 2930, the behavioral health clinician, where we are hiring for 24 vacancies across DPH locations. As we look to fill these vacancies, the batch hiring process continues to help identify efficiencies and ensure better outcome for both candidates and hiring managers. The HR team continues to hold planning meetings with leaders and hiring managers on weekly, monthly basis to go over vacancy information and hiring plans. Hiring highlights, RN highlights for the month. We hired 4 2320 registered nurses who started last month, and we hired 2 2322 in nurse manager classification who started last month. As for the non-RN highlights, we hired 1 2232 senior physician specialist who started last month, and we hired 2 2312 licensed vocational nurses who started last month. That concludes the vacancy report. I do know that the commissioners had 2 questions based on the information that was provided. One was to provide a little context on the manager 1 and the manager 8 positions. So the manager 1 position that we're currently supporting hiring on is the 922 assistant food director position. We currently don't have an assistant director for food and nutrition services, and that's been a gap for the facility as we look at, the demand that the food and nutrition services have from just maintaining, daily services, as well as part of the recertification, the continuous improvement processes. So the position is going through the approval process, and we hope to move to the next steps with the hiring of that position soon. As for the manager 8, it is the CEO position, the position that was recently that Sandra Simon recently vacated, and we are in the process of replacement hire for that position as well. I know there was another question about charge nurses and nurse managers, and I'd like to turn over to Terry D'Antoni, who would be able to provide a comprehensive response on that.
Thank you, Priya. Good afternoon, commissioners. The question was, what is the difference between the charge nurse responsibilities and the nurse manager? And charge nurses are responsible for the activities within their unit for the duration of their shift, whereas a nurse manager is responsible for all activities on their given unit for all 24 hours in a day. So that's the difference. There are times where charge nurses will assume a different duty, such as being an acting manager, and then they fall into that other category. But their day-to-day job is they're responsible for the activities for a given shift. I'll entertain any questions if there are any.
Okay, thank you, Priya. Thank you, Terry. Any additional follow-up questions on this? Oh, I'm sorry. Is there a public comment?
There is a hand raised. I'm not sure if that's still there. Let me just check. Dr. Palmer, your hand is still up. Would you like to make a comment on this item?
Yeah, I would like to know if the staffing is aimed at when all 780 minus 120 beds are filled, or how the recruiting is aimed at the census or the potential census. It's not clear to me from the notes that I see. Thank you.
That's the only public comment.
Okay. No additional follow-up from the members? Okay. Thank you for your answers to the questions. Actually, Terry, if you could stay on, I don't know if if this is for Priya or for Terry, but given that there still are vacancies that occur in the RN staff, and so on any given day, I guess there's some shortage. Is there a shortage on the shifts because there are vacancies, and how's it managed? Or is that not something that affects on a day-to-day basis?
Great question. I can take that one, Priya. So we do our staffing, obviously to the hours per patient of resident day, and we are able to maintain RN ratios at all times. If what we may have to do is float an RN from one unit to another due to shortages of sick call or whatnot, but we are meeting the intended ratios for RNs.
Okay, great. And then actually, since you mentioned the floating, so is there, I guess, some moderation in the floating that's happening because we're fully staffed now? Or is there still some adjustment that's required because of still sort of adjusting to all of the new policies and procedures, or to some of the reorganization that's happening? Is that something you could share with us?
Great question. And we will be able to share with you a presentation at a later time. But yes, we're working on a different model at this point of how Laguna Honda deploys staff.
Okay. Do you have a sense of when that will be available?
My hope, we probably it will be completed by January, but more information, we can give you more information next month.
Okay, great, thanks. Okay. Okay, we can move on.
All right, thank you. Item 6 is the Regulatory Affairs Report.
Good afternoon, Commissioners, or good evening, Commissioners. I'm Geraldine Mariano, Director of Regulatory Affairs. I'll present the November 2024 Regulatory Affairs Report. During the month of October 2024, Laguna Honda had a total of 9 facility-reported incidents that were reported to CDPH, and 0 anonymous complaints were investigated by CDPH. The facility hosted 1 site visit in October. CDPH investigated 3 facility-reported incidents and 1 anonymous complaint, which was a follow-up investigation from a prior visit. The facility received a deficiency for 1 of the facility-reported incidents, which we received on October 23, and the plan of correction was submitted on November 2. I will also have a verbal update based from the annual SNF certification that happened on November 4. There were they conducted investigation to 29 facility reported incidents and 2 anonymous complaints. The facility reported incidents were from June, July, August, September, October, and November. And the anonymous complaint was shared to us when they came here, which was for November 2024. All the 29 facility reported incident and the 2 anonymous complaint had 0 deficiencies. And currently, we have a total of 88 facility reported incidents that have not been investigated by CDPH, and 11 cases with pending outcome from CDPH. We are working with CDPH to close our open cases and to ensure that our internal list is accurate. Please let me know if there's any questions or comment that I can address at this time.
Thank you, Geraldine. Is there public comment?
There is. I have a hand up. Dr. Palmer, you've got 3 minutes.
Oh, hi, it's Dr. Palmer again. The backlog of CDPH remains kind of shocking, and of course, one can only surmise that funding for regulatory agencies is going to get worse after the inauguration, the presidential inauguration, and what can be done? I mean, the facility really needs guidance on these. So I know President Chow is frustrated. I mean, ex-President Chow is frustrated too. And what can be done? Thank you.
That's the only public comment.
Okay, are there any from the members of the committee? Dr. Chow.
Yes, I'm glad that it sounded like they were closing some of the fries, and I guess that would get reflected on our new record next month, not right? Because it's not reflected in here. And I do think that it appears that at least at the moment we have a small number of deficiencies upon the ones that were already looked at, and even more now in terms of the percent of real deficiencies that were found from the FRIs. So I think that will be useful for putting in the 20 some odd that they had, which will show the difference. But how are you working? Because it sounds like we've been working with them in terms of clearing up the numbers. And when we look at your record through November of last year, a whole year ago, it was cleaned up. So were some of these deficiencies that they brought, that some of the 20, going all the way back the whole year, or they're still, just sort of current? I mean, what could we expect in seeing the black bars go away? So,
let me try
question.
Yeah, go ahead.
So that's the question: is the ones that were cleared this last week or the last few days, are they very old, or are they still working concurrently, kind of, and we're still backlogged on the previous year?
So there are about 11 cases from 2023 starting that are from November and December. What they reviewed last week was from June 2024 to present. Most of them were in the month of June that they reviewed, with the next handful from October. And then during the survey, we discussed with the, what is her title? The district supervisor?
Administrator.
Okay, administrator. Thank you, Geraldine. The new administrator for the Brisbane office, looking at our cases from October to May, because during that time we were under only Medicare, if you'll recall, right? We hadn't been fully certified in the CMS program. And so she shared with us that those cases are under the state guidance or guidelines. And so she is working with Geraldine behind the scenes to review those cases and see where we are, what has already been closed on their end, so we can provide you with accurate information. And we expressed to her that we share this with you all in partnership with our governing body and we want to make sure numbers are accurate. So we're waiting for a formal written response, and then hopefully we'll have that for next month, and we'll see really low numbers left.
Thanks. That is a hopeful update.
Yes. And I will say Laguna Honda is fortunate, given how much partnership and support we have from CDPH. CDPH just held their annual meeting with hospitals and SNFs throughout California last week, and they shared their backlog is, it is upwards in the thousands across the state. So we are really fortunate how much they have been reviewing and prioritizing our facility.
Very good. Thank you.
Wow, that puts it in perspective.
Yes.
Really. Okay. We can move on.
All right, thank you. Item 7 is Laguna Honda policies.
Good evening, commissioners. For today, I have 9 departmental policies, 3 revisions for admissions and eligibility, and 1 deletion. For nursing, there were 2 revisions, Rehab Services 2 revisions, and Social Service 1 revision. We did receive your 4 questions regarding the policy, so I'll go over that. The first one is 404-03, a signed copy of the form and having the word may as being permissive. The response is the may is used because in the past, every resident or patient or representative was given a copy of the CSAA, but some of the residents could not store the CSAA securely and sometimes would lose it. So may is not used in a permissive sense of the word, but as a result of their options to request a copy and not at that time. For 30-01, this is regarding the SFHN Administrator in Integrated Rehab Services, and then the SFHN Director of Integrated Rehab Services. They're the same person. That is DeRay Swigger, who oversees both LHH and ZSFG. And similarly, the same for the Medical Director, Dr. Lisa Pascual, also is assigned to both LHH and ZSFG. For 80-05, we updated the policy with your recommendations with the but are not limited to. And then the final one is regarding the restrictions on mental health information regarding the significant psychosocial changes. So no, it would not be impacted. They're just updating the psychosocial changes in terms of the physical, mood, and behavior, which is not putting it into protected health information.
Okay. Are there any further questions or comments on the policies and procedures after the online? Yeah.
I do see a hand. Dr. Palmer, do you have comments or questions about this item?
I'm sorry, that was left over. Sorry.
No
I'll
worries.
put my hand.
Okay, that's no public comment.
Okay. Yes, Dr. Chow.
Thank you, and I do appreciate your responses. I'm still a little concerned, or just trying to understand the rehabilitation organizational chart. It appears, as I read this, that we're taking rehabilitation as an overall department responsibility, and that there are certain sections that are being done here and others, I guess, being done at well, I don't know. I guess, for example, speech language therapy, it says the supervisor is at LHH and ZSFG. And so clearly that's kind of one supervisor in SFHN that is responsible for all of the 2 big hospitals. And others, let's say under senior physical therapists, then it goes down and it says that there are ZSFG, OP physical therapists and physical therapy assistants, which sort of sound like there's none at Laguna. So then meanwhile, if you go under Eric Robinson, who's a senior physical therapist, then there are the LHH physical therapists. So the chart perhaps is what the confusion is, because I don't really understand then when we look at Laguna, which is our responsibility here right now, who's under whom at Laguna, and are they splitting people and you go Monday, Tuesday here and Wednesday, Thursday, Friday there, or is there really a dedicated group at Laguna? And I don't think the org chart is clear about that.
I can help a little bit, Carmen. So we are happy to take that feedback to DeRay. I see she's not on the call this evening. What I can share in regards to my understanding, so the Rehabilitation Services Department is a centralized department under the Health Network. Both entities, both at CSFG and Laguna Honda Hospital, as well as Health at Home, report up to DeRay. There are staff in both Rehabilitation Services Department, both at Laguna Honda Hospital and ZSFG, that work at both places. So just as you kind of alluded to, Commissioner Chow, someone might work 3 days a week at Laguna and 2 days a week at ZSFG. That's the beauty in truly having a centralized department. And yes, the services are all within that department to be a rehabilitation center under Title 22 and for the acute care facility. There are particular services that that department must support, which they do and are staffed appropriately for, to provide those dedicated services to Laguna Honda.
Okay, so I'm just concerned that if I were reviewing this policy, I would have been confused.
Sure.
Because sometimes we list people and then sometimes we're not listing where they are. So perhaps it's accurate, but I'm just a little concerned that a surveyor might in fact find that this chart is a little confusing. And then when you read the job descriptions that you have all written, so much of it sounds appropriate, but I think if you read in the context that, oh, now we're talking about physical therapy or now we're talking about another unit, then perhaps it makes sense. But otherwise, it really is a little confusing. There's a chief of a service. There's a executive administrative integrated rehabilitation service. And then there's also a director of integrated rehabilitation services. And while I think this is probably accurate, it is a little confusing if somebody were trying to read how the rehab unit worked here. So I see no reason not to pass this, but it would be nicer if it were really perhaps looked at again and trying to clarify what is now specifically done at Laguna. We're trying to do that with so many of our policies, even though we're trying to also mirror that the department, has uniform policies throughout. So one rehab unit and the other rehab unit shouldn't have two diverse policies. In order to be more specific to Laguna is what I'm suggesting that we try to write this policy in the future.
Happy to do that.
Okay. Great. Oh, yes, Dr. Green? Oh, yeah. Okay, if that's the end of the comments, then yeah, we can have a motion to recommend approval of the policies and procedures to the full commission.
I move that we recommend to approve these policies and procedures to the full commission.
I would second.
Okay. Okay, that's 2 months in a row, I think, that we were able to do this without having to worry about additional edits and clarifications. So good work.
And also, I would acknowledge that staff responded within the same day today, and thank you all because it was a Tuesday and they had less time than they normally do. So extra appreciation to everybody.
Yeah, particularly given the survey last week.
Yes,
Yeah.
yes. So item 8 is a consideration for a closed session.
Move to go into closed session.
Second.
All those in favor?
Aye.
All right, everyone, please give me 30 seconds. Those of you from the public will not be able to see or hear us while we're in closed session, but we will be back. And thank you for participating and providing public comment. All right, we are back in open session. Commissioners, please consider a motion to disclose discussions held in closed session or not.
Move not to disclose.
And I would second not to disclose.
Okay, all those in favor?
Aye.
Aye.
All right, thank you. And now a consideration for adjournment.
Move to adjourn.
Second.
All those in favor?
Aye.
All right, thank you. Give me 30 seconds to close this down. Thank you, everyone.
Okay, all those folks